Hi, everybody, and thank you so much for coming. My name is Sarah Lefebvre, and I'm Director of Community Health Initiatives here in the College of Health Sciences. And I'm going to just very briefly introduce tonight's session, and then I'll pass it on to our moderator, Rita Landgraf. So first, I see that there are a couple of new faces here in the room, so for those of you who haven't ever been to STAR before, welcome to the building. And please, see any of us who work here at UD if you're interested in learning more about the building and our clinics and our research labs here. And as you drive away tonight, you might notice over the building that our second building, the tower is rising above. So it'll be a 10-story tower that's expected to be completed next year. So briefly, just to give you some context for this session, this is a partnership between our faculty team here at the university who are developing the DCHI, so the Delaware Center for Health Innovation, Healthcare Workforce Learning and Relearning Curriculum. So that project includes a number of modules specific to primary care practice teams, but then we have these additional population health sessions that are kind of standalone sessions that are open to the public beyond the primary care team to help provide some training around healthcare innovation and population health topics. And then in addition, we partnered today with our UD Employee Health and Wellbeing team. So Beth Finkel, our director of that program, helped to plan this session. So just briefly, the format for tonight's session, I'm going to give you a little bit of background on each of our panelists, and then they'll each have an opportunity just to take a couple of minutes to tell you about themselves and their work. So you can kind of keep in mind who's sitting on the panel and who's up here, who you might want to direct questions to throughout the night. And then Rita will take it away to start asking some questions. Throughout, if you'd like to write a question on your index card and pass it down and kind of hold it up, I'll grab those and feed them on to Rita to ask of the panelists.
No big words, though.
That's right. And just a heads up for those of you who've had very stressful days at work today, perhaps, we're going to close tonight with a really brief mindfulness exercise, so you can look forward to that at the end of the evening. And then I think the last logistical note here is that we are providing CMEs tonight for those of you who can use them. Make sure to complete your eval if you want CMEs for tonight. That's kind of your ticket to getting the CMEs. Please return that to the front desk if you'd like them. And this is our accreditation statement, so none of our panelists had any financial disclosures to make tonight. Unfortunately, that's right. So really briefly, I'll introduce each of our panelists, and as I go through, they'll have the opportunity to continue to introduce themselves. So the first participant on our panel is familiar to probably most of the people in this room. So Kathy Matt is the Dean of our College of Health Sciences, and she's also the Executive Director of the Delaware Health Science Alliance. What many of you may not know is that Kathy actually has a background in neuroendocrine research, and a lot of her research really focused on stress and kind of the physiology of stress and its impact on the body. So we're looking forward to hearing from her about that. And Kathy, I'll give you an opportunity if you'd like to walk through a couple of your slides before we continue on.
Okay, sounds great. So thanks, Sarah. So I thought that it might be good if I just kind of level set everyone about stress. So I wasn't sure if you were coming tonight, if you sort of knew what stress was like, or if anybody had any stress in their life. So I thought this slide is always, placeholder for me. So we could relabel it and say balance, but certainly rethinking to-do lists may be a familiar thing. But the other thing that I really want to point out is you look at that to-do list, and certainly I think when a lot of us think about stress, we think about the negative consequences of stress. So what makes you unable to remember things or think about the things that, or focus on things, or enhances your cravings for salty and sugary things and all of that. But what I also want you to remember is that actually stress is a really good thing as well, if it's acute and if it's short and if it's short term. So when we talk about stress, it's also the thing that allows you to sometimes relate things together, think about things, and do things that you really didn't even know was possible. So a lot of times when you hear about athletes, they will be practicing a particular event that they're going to do, and then when they do it the day of the event, if everything is in place correctly, they do it much faster or much better than they ever thought they could. And that's actually part of that acute stress response. So the next piece that I really want to do, and that's why I think we decided that they would start with me, is that a lot of times when people talk about stress, they think about stress as something that's just in your mind. And in fact, what I want to say to you is that stress is also, it's not just in your mind, it is about your physiology. And I think if you understand a little bit about the physiology, then it makes a lot more sense in terms of what behaviors it triggers and what are the things that you can actually do to decrease stress. So there are actually two parts to the stress response. The one I'm sure that everybody's very familiar with, fight or flight. So if a lion walked in this room right now, you know, your heart rate would go up, your respiration rate would go up, and that is all triggered by what we call catecholamines. It's the response of the sympathetic nervous system, and usually it's a very short-term response. So you probably know this as adrenaline. Some of the other neurotransmitters are norepinephrine and epinephrine, but heart racing, rapid breathing, nervousness. Sometimes this can also lead to lack of appetite, loss of weight, difficulty sleeping. So that's sort of the immediate response. If the stressor is of long duration or it's a very intense stressor, then in addition to this part of the axis, then you trigger the second part of the axis, which is we call the hypothalamic pituitary adrenal system, and you get an increase in cortisol. And so, you know, if you ever go to the grocery store and you stand in the grocery store and you see all of the magazines that are there, you'll see all kinds of things that say how to lower cortisol. You know, what does cortisol do? So usually it is what interferes with your ability to remember things. We can measure it in the blood, but actually we can measure it in saliva. And a lot of times one measurement of cortisol doesn't really tell you about your stress response. So you've probably heard that now people measure cortisol in saliva. So we do this a lot of times where we look at cortisol levels because it goes through a diurnal pattern. We look at it through a day to look at what that pattern is, and it tells us a lot about your stress response. So cortisol in itself actually triggers that need for salt and sugary things, okay? And so when cortisol is elevated, what you'll see is something very, very different than the fight or flight response. Because cortisol's job, quite frankly, as a hormone, is to increase your sugar levels in your blood. So not surprisingly then, it increases your appetite, it increases weight gain, increases abdominal obesity. I have a talk that I give where I say, I can't find my keys and you can't touch your toes. It's cortisol, right? So muscle wasting is also what it does, because if you're not exercising and you need to get glucose levels, it's going to use the fibers in your muscle and break those down and break those proteins down in order to elevate your glucose levels. It also suppresses the immune response. So you always hear about kids towards the end of the semester, they get through their exams, they go home and they get sick. My daughter just got home from Ireland and I just took her to the urgent care today. She's sick, ear infection, all of that. So she suppressed her immune response all the way through to the very end, and now it hit. And then, of course, mental confusion can also be due to those high cortisol levels. So when you're looking at this slide, now think about the fact when you watch a TV show that has anything to do with police or see a movie, where do you see them? Where do you usually see the police, aside from being in the street? Where do they typically show the stereotypical picture of a police? In a donut shop, right? So they're in a donut shop because they're stressed and their cortisol levels are elevated, so that's making them eat those sweet foods. And then they're also in the donut shop because they're stressed, and it increases, so caffeine actually mimics the sympathetic nervous system. And so what we're doing then is you're actually prolonging the stress response, which is exactly what you don't want to do. So then how would you turn off the stress response? What's the clever thing that we do? You had a hard week, it's a Friday, what are you going to do?
Friday.
Okay, so drink and maybe, although hopefully not since you're on the health sciences campus, smoke. So both of those actually trigger a different system called the parasympathetic nervous system, which actually is what brings things back down to normal. So one of the other things, and Sarah told me that she was going to she was going to hang up a panel to tell me my time was up, because she knows once you get me started talking. But one of the things that, in addition to you not wanting to prolong the stress response, your next question might be, well, so why do I care if cortisol is elevated, right? As long as it's getting sugar to me and fueling my body. So these are actually, can be negative consequences of prolonged stress and long-term elevations in cortisol. So as we said, sort of increase abdominal obesity, but very importantly, increased insulin resistance. So remember that cortisol's job is to elevate glucose. Well, as soon as you elevate glucose, you're going to trigger release of insulin, and you keep that circle going. So you look very insulin resistant, and then that's why at the bottom of the slide, these things can increase your risk. They don't cause these diseases, but they can increase the risk for, and they can actually just, if you are diabetic, it can make those symptoms much worse. I said that cortisol was bad on muscle mass, but it's also very, very bad for bone density. And so if you have increased cortisol levels, this is one of the ways that we picked it up in athletes that had extremely high levels of cortisol, because they'd have stress fractures. And then you go in and you realize that they have elevated levels of cortisol, which are causing that. I mentioned suppress immune function, decrease cognitive, negative lipid profiles, because again, you're suppressing the immune response. And I think that's, so then the last slide, and this will actually lead into some of the other things that you're going to hear about, is how do you enhance the positive effects of stress and actually diminish the negative sides. And so what you would have to do then is, at the neural level, think about how do you change your perception of stress, your reaction to stress, create some buffers and resilience to stress, and I think you're going to hear about some of that today. And then, of course, at the systemic level, so at the physiology of your body, what's the best things you can do? Well, by the foods that you choose to eat. So we've got some nutritionists here who can tell you about that. And certainly exercise. If you think about exercise, it stimulates adrenaline and noradrenaline, puts you on a treadmill, your heart rate's going to go up, your blood pressure will increase, your breathing will increase. All of those things will change. When you finish your exercise, all of that comes back down to normal, because your parasympathetic nervous system kicks in. So that helps to adapt your body and build your own endogenous or your own internal mechanisms to deal with stress. So that's a really, really good way to sort of bolster your responses to stress so that you don't go into the negative consequences. So I think with that.
Nice job, Kathy.
And so again, as Dean Matt mentioned, we had wanted her to go first just to kind of help to legitimize the topic. And so we're all sort of in this, we have it in our frame of mind that this isn't something that's just all in our heads, that there's a real physiological response when we're talking about stress. So next, we'll introduce Beth Finkel. So Ryan Schuler was listed on your program, but she was sick and unable to be here tonight.
Because of stress.
That's right. Well, her boss is Beth Finkel, so hopefully it's nothing related to workplace stress. But Beth is our Director of Employee Health and Wellbeing here at the university. She has her MPH, and she's a certified health education specialist. And Beth has spent 10 years in all different workplace environments developing really holistic programs related to health and well-being. So I'll give Beth an opportunity to introduce herself.
Thank you. Thank you, everyone. In brief, I'm here today to really talk to you about that employee lens, and through the lens of really being the person who has that over-amounting workload, and really how do you create those healthy boundaries for yourself. Through my career, I've certainly worked with a number of different companies that have been on completely opposite ends of this well-being spectrum, and really trying to meet them where they are and then develop a wellness program that fits their population. One of the beautiful things here at the University of Delaware that I've been able to play a role in is really being that connecting piece, really looking at employees as humans and bringing us back to that human foundation, and we're social beings. So for me, it's important to really identify what resources we have here at the University of Delaware, and then start connecting the employees to what makes sense for them. Under this roof alone, we have the different clinics that are available. Some of our dietitians we've worked closely with here in the front row. Health coaching is another great benefit that we partner with closely here through the College of Health Sciences. The physical fitness is really what you'll see a lot of people sort of gravitate to, but well-being encompasses so much more than that. So my job and my really passion, if you will, is that I want wellness to be a holistic adventure for whatever that means to you. And that's what I'm here to really talk to you about today.
That's great. Thank you.
Thank you, Beth.
So next I'll introduce Tracy Bolander. So Tracy is the CEO of Mid-Atlantic Behavioral Health. She's a licensed psychologist, and she's partially here tonight to sort of represent a clinical perspective when we're talking about stress. And like Rita, Tracy's also on the board of the Delaware Center for Health Innovation and has been very involved in the health innovation work happening in the state, especially particular to behavioral health and the integration of behavioral health into primary care. So Tracy, I'll give you a chance to introduce yourself and anything else that the audience should know about you tonight.
So I wear too many hats, and so I can speak about stress not just from a clinical level as a psychologist, but certainly at a very, as you classified it, human level too. I am the owner of Mid-Atlantic Behavioral Health. We are probably one of the largest outpatient behavioral health practices in the state. We have about 34 licensed professionals. We have 4 locations, and take an integrated approach to behavioral health. And as Sarah mentioned, we are so excited that finally healthcare is catching up and letting us move outside of just our behavioral health world into the primary care world as well. And we're doing some integrated care at some sites, which is very, very exciting to us. My background clinically, I'm a licensed psychologist. My clinical interest is forensics. I do a lot of expert witness testimony in criminal cases, so lots of real high stress level. In my other life, I'm also a retired teacher and school counselor. I taught elementary school and then was an elementary school guidance counselor for 14 years before I went into forensics. My husband liked my first career a whole lot better. Really got to the point where he went, just don't tell me about your day. I don't want to hear how it was. And now we own Mid-Atlantic Behavioral Health together. So we work together, live together, and raise a couple of young adult children together. And I'm not sure that that's any less stressful than it was when they were toddlers. It's just different stressors that we have now that they are reportedly grown. And so my focus, and because I'm also an employer, we have probably about 50 plus employees that work for us. We didn't start that way. We started with about 4 10 years ago, so we've grown to a much larger company now. So also am very well aware of stress as it relates to the employee environment, and one of the things that is most critical to me as an employer is the culture and really having a very psychologically healthy workplace as well. So I'm happy to speak on things related to sort of the clinical aspects of stress, both as it relates to adults and children, because I have experience with both of those, as well as sort of the employer, as well as the very personal experience of stress.
That's great. Thank you.
Thank you, Tracy.
And lastly, I've noticed the two PhDs here have slides, so I'll introduce Mike very briefly, and I think he's got a couple of slides as well. So Mike McKenzie is an assistant professor in our Department of Behavioral Health and Nutrition here at the university. He also has an appointment in our Department of Human Development and Family Studies. He's the program director of our graduate certificate program in health coaching, and he's also the director of our mind-body behavior lab, so probably lots of stress in his life wearing all those hats as well. And Mike's background is in health and exercise psychology, and you'll notice the little bit of an accent that he's also registered as a clinical counselor in British Columbia, Canada.
Right. I'll try and keep my oots and a boots to a bare minimum, but I say nothing about the A's. Those just flow freely.
Can't help yourself.
Can't help myself. Thank you so much. So really the work that I do now is in this area of mindfulness, and I'll share a little bit of my personal narrative to tell you why that is my focus. So I've been really lucky to work in this area for about the past 17 years with a number of different populations, a lot in the area of oncology with cancer survivors and their families, as well as in addiction settings, and with the general population. And that's everything from just sort of your typical person, if there's ever any such thing off the street, to performance athletics through an Olympic training center back in Canada, and then with a whole host of clinical populations. And what the research says, and what we've sort of anecdotally found, is that this whole notion of mindfulness is really a master key around a number of things, both in terms of health behaviors and in achieving different physiological states. So I want to just say a little bit about what this mindfulness is. And anybody have a definition that a working definition that we can work off of before we get going? Yes. She's a plant, by the way. No.
It's awareness.
Right, awareness. Any kind of special awareness?
Awareness of your inside and your outside.
Okay, so I'm done. No, go on.
I would just add to the present.
To the present moment. Okay. Without judgment. Okay, so in 3 people we put together the official John Kabat-Zinn definition of mindfulness. Well played, all. So really the definition of mindfulness that often comes up is this non-judgmental awareness in the present moment. And it's actually, mindfulness is a kind of a overarching term for a number of different practices, both in terms of training our focus of attention, training our ability to monitor our awareness, so sort of our metacognition of how we think about how we're thinking, how we relate to other individuals, and then a whole host of somatic practices that are really sort of speak to some of the things that Kathy was sharing in terms of down-regulating our physiology. So what we find is if we can sort of very briefly introduce people to some of these constructs and share them in a very applied way, that has a lot of personal benefit. And we can target these practices based on the individual in almost a prescriptive manner. So if somebody's needing to focus more around sort of somatic cues, there's practices that are more somatically or body focused. If somebody's really sort of having a hard time in terms of focus of attention, we can provide practices in that way. If somebody, in terms of overall processing, is having a difficult time in terms of sort of re-gearing and being able to task delegate, there's practices for that. And what we notice with this is the practices in and of themselves have some benefit, but what we often hear from individuals is they also serve this mediating function, and there's a lot of literature in this area now that says that, yeah, the practice in itself was interesting, but what I noticed was it helped me get moving more. What I noticed was I was a little kinder with my kids. What I noticed was I was a little quicker to take some time for myself or to finish that assignment or whatever the case is. So one of the areas that I'm really interested in is what's this relationship between these mindfulness practices and you as a physiological entity, as somebody that has cognitions and thinks a lot, as somebody that is probably feeling and basing their actions around those feelings, and as somebody that engages in a variety of complex behaviors throughout the day. How do we marry these two constructs in a way that promotes health and well-being? So Beth has been very, very generous in terms of her time, and last year we were able to pilot an employee wellness program through our center. And really, the preliminary research that we have from that says that people tend to report after 6 weeks that their stress goes down. People tend to report after 6 weeks that these facets of mindfulness start to go up. People tend to report things like they have a deeper sense of personal achievement. People tend to go easier on themselves, and there's this sort of overarching term that we call self-compassion. And then the other component that we notice is that things like burnout, when we're talking about an external environment, don't change at all. So our perceptions change and our physiology changes and our awareness of things changes, but sometimes our environment is a little slow to catch up. And I think that really, really speaks to some of the things that Tracy was just sharing now about that it has to be culture bound as well. So the only other thing that I'll say is that this has really become part of work culture. These sort of skills have been practiced for a number of years, but it's really come to a head in the last few years thanks to Chedmeng Tan. If you haven't had a chance to look at this book, Search Inside Yourself. It was developed by a former engineer at Google. At Google at one point, you could devote 20% of your time to whatever you wanted. And he shared, well, I want to do it on mindfulness. And it's now a very well-attended program at Google. There's about a 6-month wait list to get into the program. And they're offering it worldwide now. So those are just some ideas to share with you in terms of what this construct of mindfulness is, what are some of the mechanisms behind it, and some of the applications. So I very much look forward to your questions tonight. Thank you.
So last but not least, I'll introduce our moderator, and then we can kind of kick off the interactive portion of tonight. So many of you may recognize Rita Landgraf as the former Secretary of Health and Social Services for the state of Delaware, and we're very lucky now to have her as part of the university. One of her roles here in the College of Health Sciences is developing the UD Partnership for Healthy Communities, so really thinking about how we can leverage our skills and resources and expertise as a university to impact the health outcomes in our communities. And I know a particular area of interest for Rita is chronic stress and thinking about vulnerable populations, especially those that are exposed to violence. So a very appropriate moderator for tonight's discussion. And with that, I will kick it over to you, Ms. Landgraf.
Thank you, Sarah, and thank you all for joining us this evening. And don't forget, we also have these index cards. So if you do want to put a question on for us to relate to anyone on the panel or the entire panel, Sarah will come around. If you just want to hold that up, then Sarah will come around and get your cards. But at first, I just want to thank the panel for sharing with us. I think that they kicked us off with what I call as a good landscape. And I saw a lot of heads nodding, and I saw a lot of people in the audience actually relating to what they have heard. So I just want to ask a question of everyone on the panel, but I think I'm going to start with Mike, since you're a Canadian. Mike, do you see something different in the American culture compared to the Canadian culture, who I know Canada has a totally different health system than we do here in America? And so I'm wondering if you have observed how the Canadians, everybody experiences stress. Right. It's just part of being human in our environment. But I'm thinking more along the lines relative to the overall culture of a country. And do you think that Canadians actually, because of their healthcare system or other things that they may have implemented, that it looks different than the American culture?
Sure. And I have to speak from my own position as a white male academic that has health insurance and is very, very happy in my job, but also as a Canadian that worked in a clinical setting for many years in Canada. And I think it's interesting with that universal health care, what we the security is there that whatever happens, you can go, if you break your arm, you can go and get it fixed, and it's not going to cost you anything. I would say, and please don't broadcast this on the CBC at home, the quality of care in Canada is a little bit less, and the choice is a little bit less. So a surgery that you might have here within a couple of weeks could take 6 months to a year to several years. So there's much more of a triage system there, and that carries its own stresses.
Sure. And Tracy, from your perspective, also from the clinical perspective, and and especially in the here and now, I'm feeling that there is a lot of unrest right now that is happening in our culture, in our country, and even around the world. Some of that is politically charged. Are you seeing from a clinical perspective, and you have a large behavioral health practice, are you seeing any changes relative to the individuals coming through your doors relative to this heightened, what I'm going to call unrest that we recently have been experiencing?
Absolutely, we are. In fact, the landlord at one of my sites was like, I'm not sure how you are the only business in this recession that just keeps saying, I need more space, I need more space, I need more space. And I was looking through my paperwork because I was prepping like 4:30. And was looking at, not at all, I did it very calmly. I was looking at the APA's recent, they do a stress poll every year, and there absolutely is increased stress. And it's interesting because we hear it about a number of things that didn't used to cause people distress that now do. I think the economic times have definitely caused folks a lot of stress. I think the healthcare in our world, we hear it all the time. So despite the increased need for services, what we hear on the other side all the time is, but my deductible's $6,000. So I can't come see you, and I'm having to choose, am I going to pay for my medicine or am I going to pay for my deductibles? And I definitely can't do therapy and medication, even though I know you want me to, because I've got both of these things going on. We do hear a lot of that. We also, I think, live in such a fast-paced world, and I think the amount of stress that we see in children is way different than it was perhaps when you and I were growing up. And even if we think about the kind of stressors that our kids have, it's very different than for us. They don't go away now. Like, you might have had a crappy day at school, but it ended at school. Now it doesn't end because it's all over Twitter and it's all over Facebook and Snapchat and all that other stuff. That there's this technology is wonderful, but I think it also increases folks' stress level because there's that need for constant connectedness. And we see a lot of that, and people have intense difficulty disconnecting, both in the workplace and personally. So absolutely, we see way more. The good news is that the stigma that's seeking help for stress has definitely gone away. You're not crazy if you come to me, and you're just as likely to see your neighbor in my office as you are to see somebody that is known to be mentally ill.
Thank you. And Beth, picking up on that about the we no longer disconnect as we did at one time. And, since we are focused also on stress in the workplace, how do we support then not only our employees, but also, our leadership, our supervisor in any workplace, because sometimes I know of myself as serving as the Secretary of Health and Social Services. Like, I would immediately get emails out at all times of the day and night, even on the weekend, not actually expecting people to have to respond, but I knew if I didn't get it out, I might not get it out. And really, so sometimes I would say, you don't need to respond until Monday, although my leadership would respond. And I don't know if that's because they felt a sense of urgency or because they said, oh, she doesn't really mean you don't have to respond. Somehow that might be held against me. So how can we build strategies within, the American workplace relative to what Tracy just highlighted, that we're now a culture that does not disconnect, and sometimes we don't even know how to disconnect?
So a couple things, and you sort of hit the nail on the head in the sense that you as a leader share with your employees, I don't expect you to respond. So you're helping them and modeling.
Unless the governor was asking you to get that.
But that conversation becomes ongoing, right? It's not just that one time that you say it. You really build it into your relationship with your direct report, and that trust is built. So they know that sometimes, yes, this is something that I need to respond to, but maybe other times this can wait till Monday. But then also realizing, as you sit in the seat of the employee, you always have the power to create those boundaries for yourself. And really being able to merge and segment those different roles that you play. So many of us are playing roles as a community member, as a parent, as a new mom in the workplace, and just really being vocal about some of those boundaries that we need. Another thing that I find we're doing more of in the United States compared to other countries is that we're trying to merge some of these things together. So we don't stop our work life when we go home, right? And there's opportunities to really bring our children to things during the workplace. For example, we have Alumni Weekend coming up. That's an event most of us will have to work on the weekend, but it's also an opportunity to bring our spouses, to bring our children, and really start blending those two roles together. The other thing I just wanted to mention, a little bit off context, is the fact that the American industry doesn't support generously work leave for parents, for new mothers, for elder care. And that's really important, especially, in regards to productivity, but then in the flip of the coin, economically. So when we're having new mothers come back to work way before they're ready, they're not really producing and being efficient in the workplace. Their mind is not there. So I think that's something that we need to make big strides in.
And that leads me to you, Kathy, because as Beth has indicated about what happens relative to the mind, and you have shared with us, that many times because of the level of stress, we are not able to think as clearly. We're not able to problem solve. And so then that relates to the fact that we would have difficulty in being our best and being productive, within our work environment or even within our family environment. So and I want to talk a little bit about your research and the cortisol. If cortisol, and this is coming from your audience, if cortisol is easy to measure via saliva, why is this not a part of the mental physical health appointment?
So that's a very good question. So it relates back to a little bit of the comment that I made earlier. So if you pull up any medical textbook or a book that actually gives you sort of the normal ranges of hormones, what you will see is for the level of cortisol, it will say that cortisol could be anywhere between 10 and 30 micrograms per deciliter, and that's considered normal. It is also actually very expensive to measure cortisol levels. So normally, if you went into a primary care doctor, they would not be measuring your cortisol levels unless they expected that something was wrong with your adrenal gland, which actually produces cortisol levels. Much like now, you see the advertisements all the time on TV that you can now know what your genetic profile is and who all your ancestors were. You will also sometimes see in magazines and some of the write-ups that you can send your saliva samples away to a company and they will actually do those analyses. If you see somebody in integrative medicine or complementary medicine, that's actually a place where you would see people actually measuring your cortisol levels. So you can do this. If you went to a health spa sometimes, you might see this offering. So you can actually just chew on a cotton wad and put that into a test tube. And then those saliva samples done throughout the day, we do it a lot in research, that gives you that profile. And so normally your cortisol levels might be high when you wake up in the morning. Why? Because you haven't eaten all night long, and then they'll go down during the day. And then if you have a stressor during the day, you can look at that. You really, in some ways, don't need to see your cortisol levels probably to know that you're stressed. We actually ask people to go ahead and sort of rate your stress and then actually show how that mirrors what you might see in your cortisol levels. But again, and one thing that you should remember, and sort of to the point that everybody's been talking about life sort of being more stressful, remember that you can choose behaviors that actually change those cortisol levels or change your stress levels. And so, well, so I'll tell you in 1 second, because the other thing that I think about a lot is I sometimes think that what I want to do in my office is have a table like this and a glass of water on the table, and the glass is half full. So you can even tell by the way I said it, right? It's either half full or it's half empty. So every person who comes in for a meeting with me, I want to just say, describe that glass. So no matter what's happening in your life, you can sort of see it differently. But I think the other thing is, if it is going to be a stressful day for you, then you want to make sure you have the right things to eat. So you notice there's veggies, there's fruit. All those wonderful colors are actually great. And if you came here and you're stressed, that probably decreased your stress. The bad thing was I saw that brown container, thought I was going to go grab some coffee.
Yeah, I knew she was going
No, of course. It was nice water or iced tea or something like that, right? So my coffee cup is back there somewhere. So as you're thinking about what's going to happen in your day, try to think about those various things. And that's why I was thinking as everybody was talking, I'm such a physiologist. Like, I think you should be able to sort of put these things within parameters. And part of that is by the choices that you make, and the exercise and taking a walk and all of these other things can actually be wonderful things that help you to actually deal with all of these things and think more clearly at work.
Thank you, Kathy. Tracy, how do you know, though, from an assessment perspective, when you start getting into an unhealthy well-being? It might have started out as trying to just manage an individual's stress, but then how do you know from assessing that individual that it is actually leading to a mental health condition, maybe high anxiety, maybe depression? We know that with brain chemistry, the chemistry sometimes will change. So how do you know, if you're watching somebody and you're thinking they're under a tremendous amount of stress and you're starting to see some things that are concerning, when is it time to actually call in a behavioral health professional to help guide that person back to well-being?
And I think, Rita, what you said last is most critical, that it's less about when I'm doing an evaluation wearing my psychologist hat that my daughter always tells me to just take off and just be mom. But it's more about what other people are noticing. When it comes to stress, and particularly I think workplace stress, the person sitting next to you knows it. The person that's delivering the mail knows who's stressed. They know what's going on. So I think differentiating sort of that acute stress that's okay and sort of stimulates action and gets you going and you're able to work through it with your coping strategies. I think when we start to get concerned either as a clinician or as a lay person, talking about the employee sitting next to you, talking about your spouse at home, or even recognizing it in yourself, when it sort of tips over into that either kind of that chronic stress or that continuing episodic acute stress, like it doesn't go away. It's not just that they're irritable in this moment in reaction to somebody handing them this task to do, but you start to notice that every time they're handed something to do, the reaction is almost the same. When they're sitting there, you can almost see the tension in their jaw, in their eyes. They're very quick to react both emotionally. The other thing that you also, and I saw people go, I promise I'm okay. I do it all the time. The other thing that you start to notice is just not those emotional features. That's what people often see right away, but the physical features. Like one of the things that's always in the back of my mind when all of a sudden somebody who doesn't call out is calling out or is late or isn't quite as chipper as they used to be. So, or complaining of headaches, stomach aches. They've been to 4,000 different doctors and nobody can tell them kind of what's going on. And behaviorally, they start to do things that they wouldn't have done before. So really looking in those three domains, both the emotional, the physical, and the behavioral about the things that are going on. And once it reaches the level that's outside the norm for that particular person, that's a time to sort of step back and say, I'm wondering what's going on and when I should seek the help of others. And one of the great things about behavioral health, and I think most folks will tell you this, it doesn't hurt to come in and talk to me. We probably tell a whole lot of folks, you know what, maybe this was all you needed. They might, the average, if you talk to an insurance company, the average length of treatment for most folks is 4 visits. It's not because we're phenomenal, we try to be, but it's not that. A lot of folks just coming in and talking for that first session may be enough to point them in a direction of where they need to go. Sometimes they never make it past my intake girl that takes the call. They don't show up for that first visit, and I like to think it's because it gave them enough relief just talking about it.
So sometimes just being able to confide in someone relative to how you are feeling can actually be a strategy to help reduce stress.
To normalize it, yep.
So here's a question from our audience. Individual stress is one thing, but what can be done when your entire work team is stressed and on the edge? What can I go back with and suggest as soon as possible?
Is that somebody from my college?
This was not just the College of Health Sciences. We open this up to all.
They probably might not say.
And I will make sure she doesn't get to see the handwriting. But that's open to the entire panel. But I'm looking at Beth first, because it is
and actually that's not an uncommon question that I get on a daily basis. One of the big focuses for us this year is really looking at that team component, making sure, what, and actually separating what is the stress. Is it your manager? Is it the processes in your team? Is it the duplication of work? Is it, the connection to your coworkers? Because let's face it, we spend more times throughout the week with our coworkers than our actual family during awake hours. One really quick thing is really getting away from that sort of quote unquote toxic environment, because your body is now in that fight or flight mode. Another thing you can do with your employees to build that camaraderie is really start looking at what are you grateful for? What are the positives? And then starting to build the resilience. So you're actually teaching your brain to seek out the positive rather than the negative. I always say, it's not the easiest thing to do. It's certainly a learned behavior, but talking to your manager, really, spending some time, maybe not in your office, and going and really writing down what are our conflicts here, where can we do better, what are some short-term goals, what can we do in the long term, but really being open and eliciting the feedback from your direct manager, because I think that middle manager plays such a huge role, and then having them, they're human as well, and kind of putting some empathy back into the picture, whereas you're, as an employee, you're really judged on your individual performance, but as a manager, you're judged as your team performance. So if you never give them the chance to sort of do better, it's never going to get to that place.
And Beth, you're available, right, especially here for people that are here at UD.
Absolutely.
To kind of explore strategies.
Absolutely.
And to support various teams, departments, the university-wide.
And we've been doing that. We've been working with different departments around the University of Delaware. We've also been working with community partnerships as well to really look and build that team component so that you can have that open communication with one another. We're certainly a drop-in service. I'm proud of the hands-on feel that we have for our employees.
And Mike, with your lab, like if teams from the university want to come and explore that as a team, is that a possibility?
Yeah, so we're actually we are working with across, I think we just submitted something to the Center of Teaching and Learning. We're working across 7 different departments right now at the university, and one of the things that I've been recently asked to do as part of mindfulness and innovation program is I'm working with one of the departments within business right now. And these questions absolutely come up a lot. And I heard somebody from the audience say, they might not say anything, and that's what we find is that for many people, with all the things that are on their plate, a lot of what you're thinking never is articulated in terms of words. So creating that work culture where thoughts can turn into actions is something that people have to do on an individual level, but yet there has to be that collective mentality within the group. So it really comes down to some of the work we had done previously. It's a coaching mindset. So the coach really sets the pace for the team, and if you've got a good team and people are developing these skill sets on their own, then we tend to foster more communication.
Rita, as an employer, I think one of the things I can say in being very transparent, especially going from being a very small employer initially, where we all knew each other, we all hung together,
right,
to now we have 4 locations and people don't know each other, and we are a largely women-dominated offices, and so what we had to do is we messed up. Like, you didn't pay, it's very easy to not pay attention to that because things were so good that we just were moving and growing and shaking, and what started to happen, people were going, whoa, we don't get what's going on. What we're feeling is we're feeling harried, we're feeling disconnected. And so we had to be willing to step back from that and say, whoa, we're doing something wrong. And it's not about how fast can I move and how can I go. That has to be a piece of it, but we got to step back and get right to the base. And we found that doing activities, because we did things like we'd have happy hours, or we'd go to an event together, or we'd do a team building activity, weren't enough to really make a change. We made a real change about 2 years ago when we started using something called the Rockefeller habits. And it has really changed the way our practice operates, because we started at the bottom. We said, whoa, we got to stop all this. We got to decide what our culture is, what our core values are, and everything we do has to be based on those core values. And not just my staff being accountable for relating it to a core value, but for all of us too. my staff of 50 now know our core values. They now know our mission. And I get caught all the time. They're like, Tracy, that's really not an I can attitude. And I'm like, yep, you're right, that sucks. And I'm caught, and so I need to really change how I'm thinking about that. But I think some of the mistakes we make as employers is focusing on things and doing things or events versus coming to that core and just saying, you know what, I'm going to be really open and vulnerable, and we're going to really look at our key philosophies, and are we doing what we want to do, and can we do it every day until it becomes boring? And that's hard for us. I will say it's hard for me. I can speak from my perspective, very type A, and I'm all about what's next, what's next, what's next, right, Pam? That was my speech at the Chamber. That is my mantra, is what's next. But I realized that's not everybody else's, and so I had, as an employer, I had to step back from that because I realized I was causing a lot of stress.
Well, that kind of leads me to this, this question from our audience, and they're seeking a concrete, specific recommendation, and you just gave like what you embraced at your office, but it says academic university departments or cultures based on competition and challenging each other, which is good for developing scientifically sound research results, but that makes it hard to create a work culture of kindness or empathy. What's a way to nudge the department or the university or this environment toward a more mindful or lower stress, lower stakes community, not only a hallway full of professors?
Well, they said mindful.
So Mike's going to pick up
Ding,
on
ding,
the
ding. Is that my?
mindful.
There we go. Hit the button and get the pellet. So I think it's really interesting, and just to highlight that, some of the research that we looked at when we were developing our mindfulness employee and occupational wellness program is 74% of university faculty report moderate to high stress. So this is the majority of people. This is not a minority. And the challenge that we find for most faculty is that their roles are ill-defined, and there's a slide sometimes I have where it kind of shows all the ways that our pie gets sliced up, and there's some pretty thin slices of pie that you can kind of forget about until the deadline hits. On top of that, we're often called to work individually in terms of our own research, but then to sort of move into this collective mode, and the task switching that happens can be incredibly challenging for individuals. And as faculty, in terms of our workload, for many of us, and I already see people sort of preemptively nodding, it really doesn't stop on the weekends. It really doesn't stop when we get home. And then there's for many junior faculty, there's this whole notion of tenure, which is really what's next with a stopwatch, right, in terms of the expectations, and those can go on for many years. And I think, as Kathy has shared, once you've greased that groove in terms of your work pattern, even after you're through that, people tend to sort of still be moving with that approach. And as junior faculty come in, sometimes the mentorship is, you got to do this, you got to do that. So I think some of the what we hear culturally is that these things need mentorship and guidance and comes from leadership. But in terms of the work that we do in mindfulness, a lot of what we work on faculty with is how do you transition between activities? How do you show up for the ones that you have to do? And how do you create this, for lack of a better term, dispassion in terms of metacognition, so you can actively select and respond to what you're doing versus this sort of blanket reaction that happens. And we find when people have this sort of cascade reaction effect, that's the thing that becomes almost mindless and habitual. And once you're into that, it's really difficult to pull back out and be a little bit more deliberate in the choices that we make. So there's practices that we give people to sort of engage in specific sort of techniques that they can do. And then it really, as interesting as those are, it's more about how do you sort of take what you've learned on your cushion or doing an activity and then apply it to a series of behaviors. And some of that is really, really targeted in terms of having conversations with individuals, finding where things are working well and things are challenging. So people that have taken the class will know with me, I'll go, do this one time this week when you really want to do it and it feels right, and another time where you are cursing my name, where you're like, that Mackenzie, I can't believe I'm doing this, you know, put your sort of swear word in there that you want, thing for him right now, you wiener, sorry. And then just,
Canadian?
It is, that's the worst one, that's all we have. And then from there, we sort of start to make choices around that. So we do it when we like it, and we do it when it's challenging.
So I think also what we're hearing is sometimes you might not be able to completely change the culture that you are working within or being a part of, but you may be able to change how you react to that culture. Would that be, so you can provide strategies to support that individual in their reaction relative to a stressful environment. But you can also then, as Tracy has talked about, and Beth has talked about, and Kathy has talked about, how do we then advance the culture so that we are a culture of health, regardless of where we are? Because really, if you are looking at stress reduction, it does have an impact on health and well-being. And we know happy employees are more productive employees. So for the employer, there actually should be an incentive to create that culture of health and well-being. So I guess, Beth, I was wondering, and you do make yourself available, and I think here at the university we also have robust services, robust research going on that can even look within our culture and, you know, how could we advance it in a more proactive way to promote that culture of health. But I also had a question. You mentioned Google. And I think Microsoft as well probably has similar programs. So it seems like these new companies that have started up, you know, in the recent decades may approach it differently from the well-established institutions, if you will. Beth, do you know, the university is an employer, but many times, you know, is more from that academic institution. But I'm also thinking of the chambers, you know, the national chamber, because if we know that healthy, happy employees are more productive, why don't we see more of an effort to really promote this culture that would, at least be less stressful in their environments? It doesn't seem to me that the U.S. does that.
So they don't, and the short answer to that is we really need to be intentional when we're trying to affect the culture, and then we need to be intentional when we're trying to affect the environment. So a lot of companies are making great strides in regards to environment. So they're, really trying to make the healthy choice the easy choice. They're putting in, workplaces with lots of bright lights, tons of resources, and, really trying to get at that physical piece. But then the management or the leadership is not really advocating or walking the walk of that culture. The culture really needs to be something that is felt. It needs to be something that you go home and talk to your neighbor about. It needs to be your brand. It really needs to be in the forefront of every conversation. So I think that's really where we are having that deficit, is that we're a little bit confused with these two buzzwords of what is culture and what is environment. Environment is actual things, and they're good, but they're not going to be successful if our culture is not really pushing them forward.
Great. Does anybody else have anything?
I was just going to add, I think I am starting to see more of a shift in this, and I think one of the reasons that it's happened, and it's sad it had to happen this way, is employee choice. 6-7 years ago, I would get 400 resumes to every ad I put out there. It's not that way anymore. Employees, it is an employee's world in most cases, and the younger generation also has the mindset is, if I'm not happy here and it is not meeting my needs, I will not stick around. And so with what you often hear when folks talk about the new generation, they'll talk about the entitlement. If I do it from my glass half full aspect, I'm looking at a real employee empowerment model. And we have to recognize that employees have choices and they are consumers just as much as whoever your consumer is, your patient, your student, whoever the case may be. And I think that's actually moving it along because people are having a hard time keeping employees.
And one other thing to add to that is with this new workforce coming in and looking at culture, we need to realize there's multiple generations and we need to engage them differently in our processes. But then we also have to always wrap it back to connecting them to a purpose. And then that's when, as an employer, we'll get that drive, we'll get that impact from the employee.
Do you think that in our culture that we work too much?
I think from my lens, and again, I'm a workplace wellness, consultant in many hats. I think that we don't allow ourselves the flexibility that we need to do the work that we need to get done. For many reasons, but I think we need to better define what this flexible work arrangement means. It's not necessarily always working from home. It's not necessarily working in the evenings, but with you and your team, how does that mesh together while still servicing your other roles that you play as a parent, as a community member, and so forth.
And that brings me to this question about when does blending roles, example, of a mother, a father, we're mothers, we're fathers, we're daughters, we're sons, and we're employees. When does that start to look like multitasking? Since we're starting to, as you indicated, sometimes we blend our work life with our home because we don't disconnect, So when does that actually turn into an unhealthy thing? And how can we ensure that that we're not sacrificing, any of our roles, from a work perspective? Anybody want to?
So actually, I'm going to take a different take on that.
Okay.
Because there was some research actually done looking at women in the workplace. And the hypothesis that they were actually testing actually sort of comes out of that question. So the idea was, women want to have it all. And so they're moms and they're caregivers for their whole family, as well as maybe their parents. And on top of that, they now have a job. And so the prediction was that, in fact, if you looked at cortisol levels or you looked at stress markers, that these women who were married, had kids, had all of these people and, pets and everything else to take care of, that they would be much more stressed than women who were in the workplace and were single and didn't have all of these other stressors. And quite frankly, the results showed the opposite. And then as they interviewed, not only looked at the physiological markers, but interviewed them, they found that having all of these other things, while you may sort of say, oh my gosh, your plate is totally full, and it is, it actually brings a balance to it. Because you do have that child's performance or game to go to, and that is a reliever of that, quote, stress for them. And so it provided more balance, whereas, and again, you could do this for men as well, but this study just happened to be about women because it was focused on that question. Whereas the women who didn't have those barriers, there was no reason that they couldn't stay late at work and continue to work. And so they had to impose some of those own barriers, which is really very, very interesting. So again, some of it, as you're hearing from the panel, some of it is the way that you choose to use all of these various things and sort of your interpretation of it that can actually change. So.
Any thoughts? Mike?
Well, we have a joke around our house that there's no such thing as multitasking. There's just sequential processing really, really, really fast.
Absolutely.
And the research seems to bear that out.
Can you go out of sequence?
Well, this is interesting. Is that absolutely you can. So in terms of that ability to process things sequentially. So it can be so fast that we're not actually paying attention, right? So it's mindless, and that's where things kind of go off the rails. But if we can add a little bit of a deliberateness to that, then we process slower, and oftentimes it means that we're more selective in terms of the phenomena that we're choosing to attend to. So I think that has tremendous value, and when we're in these multitasking roles with our family and stuff, I can't tell you how many times I can speak personally. I have a 13-month-old daughter, and she is a fantastic.
Is she sequencing?
Yeah. She's a fantastic train wreck of a eater, and I can't tell you how many times I've been really enjoying that. But yet I sort of reach to my side, and I just need to check that email that one more time in case I missed anything before I get to work. Well, that's not multitasking. That's really, I'm making a choice to looking at something else in the expense of this, and this may be a healthy choice in that I need to do this.
So you get food on your
I get
phone.
food on my phone, or the choice might be to spend more time with my daughter. If I do it one time, okay, but if I do that 6 times during a meal, we've got problems. Yeah. And for many people, if we look around, there's these things that are going on in our lives right now that we're doing it the 6 times and we only needed to do it once.
So, Dr. Mike, this one's for you too.
Oh no, Dr. Mike, I like it. I feel like I should have a show and have it like a Southern drawl.
There you go.
Right.
What are the thoughts around offering mindfulness-based stress reduction courses for employees? I guess that's also for Beth then. And having a structured time in the day and/or week to drop in to support this new stress reduction practice.
Right.
Dr. Mike, what do you think?
Dr. Mike, go. I think yes, and we're certainly working on some initiatives like that on campus. Most of what we've done on campus so far is we've offered 6 weeks programs. So we initially started a program that we put together with Beth's group where we did a mindfulness employee and occupational wellness program, and we had somebody from the Center of Teaching and Learning say, this is really good. Could you do a little bit more around the teaching component? Because we know that there's a lot of literature out there in terms of how this might work for faculty and teachers. So we developed that, and from that we had another person that took, so it's kind of growing organically at this point, saying, it's great that we're going to do all this for faculty, but can we do some of this stuff for students? So we're offering our first 1-credit course this fall, which is very exciting. So the challenge is 6 weeks is a wonderful, beautiful introduction, but it's like a muscle. If you only worked out for 6 weeks, by Christmas, you're kind of maybe needing to go back for a little bit. So what we've found in terms of a program that we've been running for cancer survivors for about 17 years in Canada is that people that do our 8-week program and then drop in once a week or every couple of weeks are much more likely to continue to have the benefits over the long period of time. So it's certainly something we're looking to cultivate. The beauty, though, is people are like, wow, it'd be great to have an hour every Wednesday, but that's not how my calendar works. We're very excited about a number of the apps that are out there now in the virtual communities that can,
a lot of apps.
Absolutely, that can be built. And we've just been approached by a large third-party provider in terms of is this something that we'd be interested in co-design that's offered on a national basis. So we'll see what happens with that. But I absolutely think that that this works incredibly central to all the work that we do here. Certainly speaks to all the goals that we have as a university, and is something that the invitation should be open to everybody on campus, and whether that's a fit for them at this point or not, we'll see.
And I saw recently, because some of this also could be taught to children at an earlier age,
Right.
and then the strategies, that they could carry with them through their entire adult life. And I saw that Goldie Hawn on Sunday morning program was actually advancing this in I think it was a 3rd grade.
Right.
And actually the stress level of those children, they did go down, and their test scores went up. So academically, again, it was really proven, and it also proves that, you know, regardless of how old we are, we can advance in this level to reduce our own stress, to increase our being present and our mindfulness and being deliberate. And actually, Dr. Mike is going to do an exercise along with us before we close for the evening. But I did want to just open it back up to the panel. If there's any final thoughts that you would like to share with the group, now's your time before we do our mindfulness.
Sure. I would just encourage, you know, everyone to really find that support system within your workplace. I always sort of tongue-in-cheek say, find that best friend at work. I know it would be wonderful if we could all drop in to Dr. Mike's office as often as we can, but we can practice mindfulness on our own with our employees, with close networks that we have. Something that I think is great that people are doing is they're taking breaks during the day. They're going out and experiencing our beautiful campus and just getting away and not talking about work while they do it. And these small foundations that you start to build and then you're successful at sort of opens doors for the other healthy behaviors to come with them. You know, again, we are offering a ton of services outside of just physical fitness, really trying to do a great job of connecting our different partners through the university that we have here. And I encourage you to bring any questions that you have for us.
Tracy, any final thoughts?
I guess a couple of quick things come to mind, and it's to not be afraid of it, not be afraid of the stress, and not be afraid to recognize it and be comfortable with it and do something about it. And then also identify a person who's going to let you know when they see it in you. Because we're not always really good about doing that, and to do it ahead of time. It's not a good time when, you know, your husband comes in and says, wow, you look really stressed, and you want to go, no shit. Yes, I do. I've been telling you that. But come up with a way to do it ahead of time, just like we do with our patients, is to say, no, let's identify your red flags ahead of time, and then identify for them what you want them to do about it, not just your support system, but also those that are with you at work and can intervene on your behalf.
Great. Kathy?
So I have to say, and some of the people who are in College of Health Sciences will probably laugh, but as I'm listening to this conversation, and Beth had talked a little bit about the environments that you create, it made me think about the new building that's going up, this 10-story tower, because in the atrium space, so that we really have very deliberately and thoughtfully considered how do we create a space, and the signature in that space is about prevention and wellness. So in the way that we're picking the carpet, there will be a living wall that will be there. There will be a chef's garden on the wall to pick herbs. And really everything about it is creating collision and collaboration space. So the comment that was made earlier about academics actually being in a world where it's all about competition and being better than the person next to you, no, actually it's about collaborating together to create something that no one alone from one discipline could do. The challenges that face us ahead are complex, they're multidimensional, and the only way to sort of even be hopeful about a solution is really about collaborating and working together. And that's where the innovation comes. Like, how could we be in a better place than this to be able to create that innovation? The other one thing that I think about a lot is somebody that I worked with in Arizona worked very closely with people with post-traumatic stress disorder. And she herself was a survivor of a concentration camp. unbelievable. She's one of the most positive people I have ever met. And her favorite quote is from the Greeks, and that quote is that happiness is about achieving excellence in a life affording you scope. And so I really think that that is what it's about, wherever you are and whatever you do. It's really about deliberately being able to use your talents to create the best that you can create, and also realizing that no matter what your position, you have an ability to have a sense of control and to control what you build and what you create. And I think that gives everybody that hopeful future and that positive feeling that really takes you to an amazing place and helps to create the cultures that everybody talked about. So.
And you can always do that for yourself. What I used to tell my team at the Department of Health is that even when we had some chaos around us, which would occur almost on a daily basis, what I would say is just pause and look for the miracles, because you will find them. They are out there. I think when you're running in chaos, many times you don't take that time to pause and see the beauty around you and really appreciate that beauty. And I found for me in those 8 years that it really brought down my stress level. And during a crisis, what you need is really to be able to problem solve that. And so I made it a regular exercise for myself, was to actually pause and look for that miracle. And no doubt I would find it, even if it's that flower or that bird or, you know, just going out and breathing fresh air. That in of itself is that miracle that surrounds us. It's many times we just don't take the time to actually appreciate it. So Dr. Mike, it's now time for us to appreciate you.
It's about that time. All right. Well, thank you. So what I wanted to share, can we just forward that one more? Are we appreciating? Am I summarizing or am I doing this?
Yeah, you can summarize and then go into our however you want to do it.
Okay. This, everybody is absolutely lovely, and I would just.
Can we go back to your slide with the whale on it?
Yeah, let's go back
whale.
to the whale. It's important. There we go. All right.
There we go.
Yeah.
Yeah, you probably should move over here so you can do it.
So Beth had very kindly asked me to share this technique. This is something that was developed by a wonderful gentleman named Alan Marlette, who was basically the founder of relapse prevention in the addictions world, who sadly passed away unexpectedly. So he had really used it within an addiction setting, and what I started to use this was in an addiction setting. So in sort of the survivors of the downtown east side in Vancouver, which is some of you may know as the epicenter of the opioid epidemic for Canada and some would say North America. And what I noticed as part of that is that it wasn't only our clients that were taking advantage of it, it was our other staff members. And then as we were sort of taking this back out into a wellness setting, that people from the community were deriving a lot of benefit from it, using it in a domestic violence setting, both people that were victims of domestic violence and even individuals that had been charged with domestic violence were finding benefit from this. And we now use it with our mothers. I'm part of a project in Philly where we work with mothers that are in medically assisted treatment for opioid addiction that are still parenting, and they find benefit. And then in performance settings, we found with athletes that they would come back and say, you know, this was really valuable. So it's an acronym, but each of the things that we're going to go through is a specific skill set. So it can be, you can go through all of them, or you might just want to do S or O or B. I have one former client that says, Mike, I'll only ever be an SOB. So, yeah, I know.
It's all right.
Yeah, or you could be a burr as well, I suppose.
That's right, or a burr.
But one of the skill sets that we really want to help people with is just this ability to stop. And do you have that ability to, whatever you are doing, can you stop doing that thing? And that could be stopping doing something, checking your email. That could be stopping your cognition for a moment. That could be stopping your movement. That could be stopping a task. And again, if you don't like the word stop, pause is also a good word. It's a related sort of a synonym. So let's just take a moment together to stop doing what we're doing. And you might notice that you're like, oh, that's fine, but I'm kind of itchy. So, itch and then stop again. And you're like, oh, I'm thinking I got to get home. Okay, think about that for a second and then stop again. So facilitating this ability to stop is very helpful, and it's a skill set that we don't always necessarily have. So we'll just practice stopping for 3 seconds. And the next skill set that we want to help people cultivate is their observational skills. So when you stop, can you selectively use your attention to observe yourself and surroundings? And that might be sensations in the body, like I got a butt cheek hanging over here, so I'm just going to kind of move over a little bit. Am I in a comfortable position? Am I calm or am I anxious? Am I happy or sad? Am I focused or scattered? And at this point, this is all just data. We're not trying to change anything or do anything differently. We're just trying to stop enough so that we can be aware of what's going on around us as it is. No need to switch anything up. The next component of that is so that we can focus and develop a little bit more of this bodily awareness is a focus on the breath. Why the breath? Because most of us should be breathing. If you're not, we have other things that we need to attend to immediately, and none of this other stuff is important. But this breathing task is very important. Kathy shared a lot about neuroendocrine function. We know that cardiovascular function, as it's tied to the breath, is a huge indice of what's going on in terms of cognitive function, affect regulation, and our base physiology. So our breath is a real master indicator for what's going on. And again, just paying attention to it as it is. You might say, I can't feel my breath right now. Probably a good thing to know. It might be high up in your chest, low in your belly, in your back. It might be rapid. It might be quiet. But again, this is just more data to tell us sort of what's occurring for us in this moment. What we find with people is as we start to attend to these sensations in the body, the parasympathetic nervous system automatically just kind of kicks in, and this relaxation effect tends to take over. So let's just take a few breaths together. So I won't count them or anything. You don't have to be on my breath clock, but just sort of take 3 breaths for yourself. And again, they don't need to be long or slow or anything of that nature, just noticing the breath as it is. The next quality that we help individuals cultivate is this ability to expand their awareness. So not only can you sort of gather this data, but now you can selectively attend to certain parts of your experience. So what we find when people do a little bit of this practice is they've stopped, they've observed, they've breathed. A lot of the time there's one thing that'll kind of stick out now that they tend to focus on. It might be a sensation in the body. It might be a cognition that's coming up a lot. It might be a felt sense in the body, so some sort of emotion. But there's this ability now to kind of deepen our attention in that one particular area, knowing that we've stabilized our attention, cultivated our observational skills, and developed some regulation around the breath. So it tends to create a different frame of reference around what's going on for us on an individual level than when we first started, when we were probably a little bit more habitual and reactive. So again, notice where your attention is drawn. It might be to a sensation, it might be to a thought, it might just be that there's a constellation of things going on and there's an overwhelming sense of busyness. These are good things to know about oneself as we operate throughout the day. And the final thing that we talk about is this ability to respond mindfully. So that these exercises have tremendous benefit in and of themselves, but they pale in comparison to using the resources that we develop to sort of shift our behaviors. So having gone through this process, how is this going to change the next 30 seconds for you? How is this going to change the next 5 minutes for you? How might this change the evening for you in terms of having taken this opportunity to stop, observe, breathe, and expand our awareness? How might we now respond? Are we a little quieter on the way out the door? Are we a little bit more thoughtful when we get home? Is our drive a little bit more pleasurable? There's different qualities now that we may have a greater opportunity to appreciate. So again, take a second to think how you might respond differently having gone through an exercise like this. So my practical advice with an exercise like this, should you choose to accept the mission, is that this is great to play around with in a sort of a quiet setting. So if you have a door that shuts and a little bit of time that you can devote 2 or 3 minutes to this when you create the opportunity. And then the challenge is to do it when you're stuck in traffic, if you recall. To do it if you're running to the grocery store and you were definitely in the 9 items or less line, and that person certainly has 14, if not 15 items. That you do it when maybe one of your children is not cooperating and is as wonderful as you have raised them. That there's these other opportunities that we use it to sort of peer into what's going on for us as well. Again, not to change anything, but just as data that we can reflect on. So thank you for your time.
Oh, thank you, Dr. Mike. And thank you all for attending this evening. We appreciate your presence, and we hope that you've gained some knowledge and some strategies. And for those at UD, you have access to Beth, who's always extremely helpful, and access to Dr. Mike, and access to Kathy. And I also want to thank both Sarah and Beth for actually pulling this all together for us all to enjoy this evening. Thank you, everybody.
And please be sure I get your evaluations if you're claiming.
Oh, yes, if you're claiming. And also, please help yourself to food. There's a lot of food there.